So can you hear me? So we are starting our webinar today, and we will have just 2 hours of webinar, and which means there will still be another 3 hours to complete, and I hope to finish that on the 30th of November, that is the coming Wednesday, with this course. So today we have the Rasayana, 1 more hour remaining on the rejuvenative medicine, and then 1 hour will introduction to the 8 specialities of clinical specialities of Ayurveda, and in the next webinar, 3 hours, we will cover a little bit more details about the 8 specialities. So that's the plan. So today we are going to look at the scientific aspects of rejuvenative medicine. We discussed the Ayurvedic concepts and principles in the last webinar, and today we will be looking at the modern scientific information, what kind of research has happened, and how it relates to the foundational concepts in Ayurveda. So that's what we're going to do, a review of the scientific studies on medicine used in Ayurveda. And after 1 hour, we will have a short break, and then we come back to continue with the new topic on the clinical specialities in Ayurveda. So I want to talk about some of the herbs which are very widely used in Ayurvedic practice, and what modern research has revealed about their immunomodulatory and Rasayana effects. So here is a plant, Brahmi, and I would like to highlight that Brahmi is sometimes equated with Centella asiatica, which is another plant and which is more widely available. But here we are talking about another specific species called Bacopa monnieri. And when we use Bacopa monnieri, there are some special and specific benefits. Bacopa has been known to be able to inhibit the release of inflammatory cytokines from the microglial cells in the brain, and it inhibits enzymes associated with inflammation in the brain. So Bacopa monnieri has a very powerful effect inhibiting inflammation in the central nervous system, and so this begins to be recognized as a very important and novel therapeutics for the treatment of many disorders of the central nervous system. So many diseases in which inflammation, neurological diseases in which inflammation is an underlying pathology, can actually benefit by the use of Bacopa monnieri. So in the studies that have been conducted, the tea or infusion or even alkaloid extract of Bacopa, and sometimes even the specific chemicals isolated from Bacopa, such as Bacoside A, has been shown to significantly inhibit the release of TNF alpha, and TNF is actually the tumor necrosis factor alpha, and the IL-6 is actually the interleukin 6. So these are all involved in the development of tumor and cancer. And so this plant has been shown to very strongly inhibit the release of these factors. And so this is very helpful in the prevention of cancer in the brain. And Ayurveda Brahmi is administered even at a very young age. As a precaution, even children are administered this, and it's very good for brain health. So we can find that even regular use of the tea of Bacopa minieri has been found to provide beneficial effects. So the important point to note here is that we need to use not Centella asiatica, but Bacopa monieri. While this might be a challenge in places outside India, but nevertheless, to get these benefits, we need to use specifically Bacopa monieri. So the next plant, which is also working on the brain, is Clitoria ternitia. This is one of the sources of the plant known in Ayurveda as Shankhapushpi. This is said to be a powerful medicine for improving the ability to study, to learn, to read and understand, grasp. It's especially helpful in improving the learning process. And this plant, Clitoria ternitia, has been shown to reduce autophagy. So this plant is able to protect brain cells from being damaged, and that's by this artificially enhanced autophagy. Autophagy means, the ability of the cells to destroy itself. So we are just reviewing some of the scientific studies that have already happened on the Rasayana effects of Ayurvedic herbs. In our previous webinar, we looked at the Ayurvedic concepts and the various applications. And we already discussed one plant that was Bacopa monieri. And we have gone into which is very helpful for preventing inflammation in the brain. And now we are looking at another plant, Clitoria ternitia, which is able to facilitate DNA damage repair, and thereby this plant is able to protect the brain from stress-induced injury. So both of these plants, Clitoria ternitia and Bacopa monieri, are very preventive rasayanas. They can ensure brain health and probably can also prevent, many degenerative diseases of the brain that occur in old age. So the pathways are slightly different. Bacopa monieri helps to check inflammation, whereas Clitoria ternitia helps to, protect the brain from stress-induced injury. So DNA damage is a major cause of aging, especially also neurodegeneration. We know today that neurodegenerative diseases are on the rise. And in Ayurveda, we have given one of the benefits of doing Rasayana is, Medha, or, of the higher mental functions. And that's why this topic is interesting for us, and we are exploring what Ayurvedic herbs are able to do to prevent neurodegeneration. So it's quite well known that increased DNA damage causes premature aging. So the loss of genomic stability is one of the major factors for aging. And calorie restriction, balanced diet, a very careful choice of macro and micronutrients, and the use of many formulations, including Amalaki Rasayana and certain other specific alkaloids like docosahexaenic, etc., are now already known to be able to modulate and prevent DNA damage and thereby slow down aging. So when the DNA damage occurs, like double-stranded and single-stranded breaks, this is associated with decreased longevity. This has also been studied in many animal models. So many aging disorders are actually happening because of the accumulation of DNA debris. So Clitoria ternatia, we talked about now, has been found to be able to interfere with this process of DNA damage, and thereby it works as a herb that can prevent neurodegeneration. So both these herbs, Bacopa monnieri and Clitoria ternatia, have great preventive potential, in brain disorders. And as we talk about DNA repair, Amalaki Rasayana. Amalaki Rasayana is, a very special Rasayana made out of Amalaki. And Amalaki is Emblica officinalis, known as the Indian gooseberry. It's one of the ingredients of Triphala, and I'm sure you would have heard about this. It's a very famous medicine in Ayurveda. And Amalaki Rasayana has been found to enable DNA repair without any adverse effects. So there has been some very serious scientific studies to understand how Amalaki Rasayana works in preventing DNA repair. They did studies to find out at what level Amalaki Rasayana can work, whether it can repair DNA damage or prevent it. And the studies have shown that Amalaki Rasayana is more effective actually in preventing DNA damage much more than repairing. In other words, it's much more challenging to be able to reverse DNA damage with Amalaki Rasayana, but very effective, in preventing DNA damage. So this is Amalaki Rasayana studies. So the finding is, as I was mentioning, that even in aged individuals, now to look at the clinical applications, Like from the moment we start taking Amalaki Rasayana, we find that we are able to prevent further DNA damage. We can maintain the DNA strand-break report without toxic effects. But it's not possible to reverse. It's not possible to reverse the damage that has already happened. So this is the finding regarding Amalaki Rasayana and DNA repair. So what we are discussing today is to see the scientific basis of the concepts of Rasayana in Ayurveda, and it's very interesting to see that plants that are used and the formulations that are used have proven to be very promising in actual scientific studies. There is another important plant in Ayurveda called Tinospora Cordifolia, which is guduchi. And I think this plant must also be familiar to all of us. Here, whether it is available outside India. Yes. Is it available outside India? Does it grow in? Okay, great. Yes. So you get fresh plant, or do you get in a dried state or powdered? Okay, it's powder. So you get the white powder, which is called as guduchi sattva, because the plant is actually, ideally, it is used in a fresh state. It is best used in a fresh state. But there is a method of taking the starch of guduchi out, and this starch is called as guduchi sattva, and it's extremely bitter, and this can be preserved. So probably what you are getting is not the powder of the plant, but rather the starch extracted out of the plant, and that's a very special process through which the starch is extracted. And what we get is a white powder, which is extremely bitter. And that can also be used in places where fresh plant is not available. Now, Tinospora Cordifolia is considered to be one of the very powerful rasayanas in Ayurveda. And already studies have been done which have demonstrated the ability of these plants to improve immunity. That Tinospora Cordifolia is very helpful in infections, and for this reason, it's one of the first plants that we use for treatment of fever. If you give the decoction of spora and haki and ginger, then a lot of viral and bacterial, more than even bacterial fevers, viral fevers can be managed. Because Tinospora Cordifolia enhances general immunity very much. It improves the T cell count, the lymphocytes, and it activates the immune mechanisms which fights against infection. So this is quite well known. And Tinospora Cordifolia has also been well studied for its anti-inflammatory effects. And so it's a medicine of choice in the management of rheumatoid arthritis. But what's interesting here is that Tinospora Cordifolia has also been found. So its boosting and anti-inflammatory properties are well known. And it has been found that Tinospora Cordifolia improved physical performance and suppressed overactivation of the sympathetic nervous system. And this is very interesting new finding. So this plant is said to have, multiple levels of action. And it's very exciting to see that modern research has shown that Tinospora Cordifolia also has these ability for physical performance. And especially it makes the person calm. It can pacify the sympathetic system. And thereby the person becomes more calm and less reactive. So this plant in various ways of administration has shown good effects on physical performance, on muscle power, on maximal oxygen consumption and sympathetic activity when you subject people to physical. And if they are taking Tinospora cordifolia, then you can find that they are able to physically perform better. They have more muscle power and their oxygen consumption has been enhanced. So probably this is also a very good medicine to use for people who perform in sports. So I did not include discussions on the other aspects of Tinospora because they're quite known. But this aspect of Tinospora and its effect in physical performance is a very interesting finding. Now, there are many other possibilities. So the field of Rasayana in Ayurveda is actually opening up a lot of possibilities of use in multiple ways, sometimes very unimaginable, innovative ways. And this is one new finding, that Triphala, which is so commonly used, has been found to be able to protect the liver from the toxicity of paracetamol. We know that paracetamol is widely used analgesic and antipyretic, and one of its problems is that it causes injury to the liver. And especially people who consume this along with other medicines for relief from pain and fever frequently are at a very high risk of developing, toxicity and damage in the liver. So this can also cause acute liver injury. And Triphala, which is also attributed with, very strong Rasayana properties, has been found to be able to protect the liver toxic effects of paracetamol. Actually, Triphala is said to be very powerful Rasayanas because it combines the Rasayana effect of Haritaki, of Amalaki, which are the two important ingredients in Triphala. And both Haritaki and Amalaki have almost similar properties, except that one is hot and the other is cool in potency. And because of their opposing potential, kind of really balance out each other. And so Triphala has been found to be very effective in protecting the body. So there has been some studies which have been done. So Triphala extract at 100 mg per kg and 300 mg per kg body weight, they have found that it exhibits a very profound, hepatoprotective activity, as we call it. So, at least 300 mg per kg body weight seems to be really very hepatoprotective. So that if people are taking paracetamol, then taking Triphala also along with it seems to be a good choice, a good practice to be able to prevent the damage to the liver. So this is a new application for Triphala, which a lot of people are not aware of. The Triphala can actually prevent damage from paracetamol. And the paracetamol is widely used, and there are a lot of deaths and casualties from paracetamol induced injury to liver. Some are very acute, and sometimes it's also very long term. So I don't know whether you were aware that Triphala could be used in these novel ways. Like, these are effects which are not so well known, that Bacopa can prevent inflammation in the brain, and that Clitoria ternaceae can, protect the brain from stress injury, and then Amalaki Rasayana prevents DNA damage, and then now here is Triphala preventing damage to the liver. So there's quite a lot of yes, so this is really very interesting. And in fact, the most common cause for acute liver failure is paracetamol. So this is really something very interesting and useful to know about Triphala. So overdose of paracetamol has been noted as the most common cause of acute liver failure. So a little Triphala can go a long way in preventing, mortality from paracetamol. So here's where Ayurveda can support and help, even modern medical practice. So this is about a new finding about Triphala. And then let's look at Ashwagandha. And I'm sure, the dosage I already mentioned, it's 300 mg per kg body weight. So if you take 300 mg per kg body weight, then you are able to prevent toxicity from paracetamol. I hope you got it. I go back to the slide, and it's mentioned here in the slide. Here you can see the 300 mg per kg body weight. So that's the dosage in which it's effective. So they actually tried it at 100 mg per kg body weight and also 300 mg per kg body weight, and they found that it's more effective at 300 mg per kg weight. And now here is Ashwagandha or Vidyapeetham, and this is actually much more than a Rasayana. It's more like an aphrodisiac, but it also has Rasayana properties, especially on the mind and the brain. So it can reduce anxiety, and it also has antidepressant activity. And this is actually coming under the group of Rasayana Vajikarana drugs, which means that it's effective and useful for both as a rejuvenative and as well as an aphrodisiac. So it serves both these functions. So here they tried two things, Ashwagandha as well as Kapikachu, which is the Amalaki was something which I typed long back, but it just displayed now, so you can ignore it. Now we are into Ashwagandha and Kapikachu, and these Kapikachu is Mucuna pruriens, and Ashwagandha is of course Withania somnifera. So these are both really aphrodisiacs. They help in improving fertility in the males especially, and also sexual performance, but they are also rasayanas or rejuvenatives. So here a schedule of combined rasayana Vajikarana, that in the night there was a dose of Ashwagandha Churna and Kapikachu Churna in the morning, and this was continued for about 8 weeks. And this combination was found to bring about a very significant clinical recovery in patients who were suffering from anxiety and antidepressant activity. Now Ashwagandha is very strong. It enhances Pitta and increases Ojas. And any medicine that increases Ojas can bring down anxiety and depression. But the only problem is if you take too much of Ashwagandha. So in people who are already very Pitta and people who are very Rajasic and aggressive, then we should avoid the use of Ashwagandha. Ashwagandha, if we overuse, is also known to sometimes cause bleeding disorders. So we have to use this very, very carefully. So this is a very interesting use of these two plants in combination for the management of anxiety and depression. And now we discussed in our previous webinar on the special medicinal use of Pipali Rasayana. I hope you remember we discussed about how Pipali Rasayana is starting with 1 gram. We increase 1 gram every day until it goes up to 5 grams. And then we give 5 grams for about 5 days and then again reduce it 1 gram each till we come back to 1 gram, and then we stop this. This takes about 2 weeks to be completed. And this is called as Vardhamana Pipali Rasayana, or using long pepper in an escalated dose. And this study was conducted in about 73 patients who were having the symptoms of rheumatoid arthritis. And they were given this Rasayana for 15 days. So, of course, patients who had any other serious problems were excluded from the study. And it was found just by the application of Pipali Rasayana, the patients achieved 50% release from their symptoms. So this plant enhances Agni, is Amapachana, it pacifies Vata, and also has Rasayana effects in the body. And it was also found that when the patients were taking this medicine, there was significant decrease in the erythrocyte sedimentation rate, which means the ESR had very significantly reduced. So, of course, this Pipali Rasayana cannot be the only intervention in rheumatoid arthritis. Rheumatoid arthritis is, complex and needs many other treatments, but this is a very important component of the Ayurvedic treatment plan in the management of rheumatoid arthritis. But there are some precautions to be taken. We have to ensure this this never be done in very hot weather, and it should not be done when patients, when this treatment is being done, patients shouldn't be taking very pungent or substances that heat up the body. So that's really very important to avoid. Otherwise, there can be aggravation of pitta, and we have to be careful not to, use this in patients who are having pitta prakriti. So this is not only effective in rheumatoid arthritis, it is very effective in chronic liver disorders that also we discussed in our previous webinar. It's also very effective in bronchial asthma, chronic obstructive pulmonary disease, and such conditions. So this is a study which showed very positive results. Now there's a very unknown application also of Pipali Rasayana, and today I'm really talking more about the unknown effects of many of these herbs. And Pipali Rasayana, its use in liver and in lung bronchial diseases are much more well known, whereas its use in rheumatoid arthritis is not so well known, as well as in giardiasis. I don't know whether you have read this. Have you heard of this condition? It's a worm infestation. It's a parasite. Yes, it's a parasite. Yes. This comes from, water. Yes, it comes from water. If you walk in what's infected or place your feet, then this can happen. So this is caused by the Giardia parasite. And so what we have found is that Pipali Rasayana, the Rasayana that we described right just now, the Pipali Rasayana given in this way in the ascending dose, starting from 1 gram and then increasing to 5 grams and then gradually tapering it back again to 1 gram. Along with Butea monosperma, which is called Palasha. And this was tested for giardiasis in mice. So these mice were actually infected with Giardia lamblia trophozoites, and it produced up to 98% recovery from the infection. So we might be curious to know how Pipali Rasayana works in this condition. So whether it's actually killing the worms. But interestingly, it was found that Pipali Rasayana is not really killing these worms, but it is actually activating the macrophages. Macrophages are, part of the body's own defense mechanism. So there's an index called the macrophage migration index, as well as phagocytosis. These are two mechanisms in which the body is attacking unwanted substances and microbes in the body, and it will digest and kill them. So it was found that Pipali Rasayana was able to actually enhance this process, and thereby the body itself was able to destroy parasites. So this is very interesting that Pipali, yes, that's really fascinating. That Pipali is, again, you can see many of these rasayanas in Ayurveda really work through the body's defenses. So these are, after the vaccinations, initial vaccinations, I think we should promote the use of a lot of Ayurvedic herbs, which can really, boost immunity at multiple levels. And a lot of the use of harmful chemicals can be avoided by judicious use of these herbs. And herbs like Piper longum can also be made globally available. They can be cultivated in large quantities and then harvested and packaged. And so this is the thing. So this mechanism of Pipali or long pepper is the enhancement of the host resistance. And that's by enhancing the host resistance that Pipali is able to fight against this infection. And we also discussed a little bit earlier about Tinospora Cordifolia, which is also a herb which can enhance immunity and which also has been found to be very promising in the management of infections. And I also mentioned that when there's fever, like viral fevers, in Ayurveda at first we give medicines which include Tinospora Cordifolia as one of the ingredients. So the Ayurvedic approach also to managing infections, including infectious fevers, is to enhance the host resistance and thereby enable the body itself to fight the infection. So this is about some things about Pipali Rasayana leper, and so its uses are really multifaceted. So now we will look at a few more Rasayanas. These are compounds, and now I'm going to discuss about a Bala compound, which includes a few herbs. It's not a single herb, and we'll just look at them. These are Atibala. The botanical names are also given in the slides. So Atibala is Abutilon indicum, and it's a shrub. I'm not sure whether it's found outside India. So there are Bala. Bala means strength, and it also means immunity, and is used to actually enhance the immunity in young children. So it has Atibala, and then Amalaki, which is of course well known. It's Embolica officinalis, and then is Embelia ribes. Embelia ribes, there's a small spelling mistake. Actually, Embelia ribes, which is Vida. And this herb is actually a very good anthelmintic. I mean, it destroys worms in the body, and it's very commonly used in administered in children because children are very prone to manifestations, and so that's the reasons why it is here in this formulation. Embelia ribes is an anthelmintic, and it can kill worms and other parasites that infest the stomach. And then we have Guduchi. Again, you can see that Guduchi or Tinospora Cordifolia is included for its immunomodulatory effect. And then you can see here again Pipali. So you can see how the herbs are combined and how together they produce a powerful, immunomodulatory effect on the body. So the Pipali we studied individually, Guduchi we studied individually, Amalaki we know has powerful immunomodulatory properties, Pipali also. And then we have Yashti Matu, which is actually licorice. And licorice, very good anti-inflammatory agent. So it can very easily, help the body to withstand stress and inflammatory responses, and that's why this is added in this formulation. And then we have Shankapushpi, one of the Shankapushpis we looked at earlier was Clitoria ternaceae, which has also got very protective action in the brain. And then Vacha, which is Acorus calamus, which is actually called the sweet flag. Some of the varieties of sweet flag have a chemical called beta-azarone, which is said to be carcinogenic. And so there are some restrictions on its use in many countries. But in Ayurveda, this is used, the sweet flag or vacha is used after purification, and so it's generally considered to be safe. And then we have musta, which is the nut grass, or otherwise called as Cyperus rotundus, and this is very tonic to the stomach, and it's a very good digestive, and this is also known as children's medicine, because it is very helpful in preserving the health of the gut of children. And so musta or nutgrass is often called as the medicine for the child. So also Ativisha. Ativisha is Aconitum heterophyllum. So this is the non-poisonous variety of aconite. There is Aconitum chasmanthum or Aconitum, which is extremely toxic and also cardiotoxic, but that's also used in Ayurveda after purification. But this is the non-poisonous variety. So adding all these herbs together, we make in Ayurveda a very special preparation for children, and this is known as the Bala compound. And this is administered to children, as you know, an Ayurvedic vaccination in the form of oral drops for 6 months. And the result was assessed for serum immunoglobulins, IgG, IgM, IgA, every month in 2 follow-ups, at the 3rd and 6th months. So this Balo compound was given as oral drops. And after a period of 6 months, and they observed at every 3 months and every 6 months, they found that there's a significant increase in immunoglobulins after administration of Bala compound. So this is a natural way of enhancing the natural immunity of children. So it's not clear as of now. There's not been enough study to illustrate whether this is an alternative to the modern vaccinations. Some of the modern vaccinations are essential. Many of the modern vaccinations are not so essential, but they are commercially promoted. And many modern vaccinations can also be harmful. So there's always a need to look for alternatives to vaccination. And the Bala compound is a very promising formulation which has shown definitely an effect in enhancing the factors which determine. So more studies are needed. So this is again an application of Ayurvedic formulations as a Rasayana. Now we had also discussed about Shilajit, and again I'm going to talk about some unknown aspects of Shilajit. So Shilajit is used as a Rasayana in many diseases including diabetes, even in rheumatoid arthritis, where especially in diseases where the microchannels of the body are affected. And this purified Shilajit was evaluated in healthy volunteers between 5 and 55 years of age, and it was studied for its effect on male androgenic hormone, that is testosterone. And a randomized double-blind controlled clinical study was done, and Shilajit was administered at a dose of 50 milligrams twice a day, and the treatment was done for about 90 days. And over 90 days, it was found that it increased total testosterone, and also the dehydroepiandrosterone, which is a precursor for testosterone. And compared to the placebo, the testosterone levels had significantly increased with the use of Shilajit. So here's again, a very interesting use of one of the Ayurvedic drugs that are used for its immunomodulatory and activities. So it's also interesting to note that when Shilajit was used, the gonadotrophic hormones, luteinizing hormone and the follicle stimulating hormones were not affected, their levels were maintained. So this is a very promising substance. Of course, it's not of origin, rather it's a mineral origin, but this is very promising in this area. And then we have another formulation, it's called Jivana. Jivanaya means to enable the life process, and it's a polyherbal formulation. Many of these herbs are not so available. They are from the Himalayan region. Venturing to list all those herbs and get information on Jivanaya Rasayana by searching for it, and if there is any clarification needed, I can always list it. The reason I'm not listing it, there's also some controversy regarding some of the plants, so we'll need to go into a very detailed discussion if we want to disclose the ingredients. So it's but please note that name, and it's sometimes available. And in some studies in which the alkaloid fraction of the Jivanaya Rasayana was extracted, and the rheumatoid arthritis was studied, so the pore swelling, the inflammatory responses, expression of cytokines, and all the inflammatory markers, they were analyzed in rats. So they first induced the arthritis in the rat, and this was evidenced by upregulation of the inflammatory mediators, cytokines, and the paw edema. Found that when they administered this Jivanaya Rasayana, the paw was reduced and cytokine markers came down very significantly. So it even worked at the gene level and downregulated the messenger RNA expression of the pro-inflammatory cytokines. So they have also found that there are 5 different alkaloid compounds which could actually be responsible for this effect. And so from this we know that Jivanaya Rasayana is very helpful in the management of inflammatory arthritis. So with this we are concluding the Rasayana module, and we have actually 4 more hours left for the discussion of the clinical specialties in Ayurveda. We will just spend 1 hour of introduction to the clinical specialties in Ayurveda. Okay, so we can, I'm sorry it took a little longer than expected. Today we do the introduction to the specialities in Ayurveda. So 1 hour, and then we'll still have 3 hours to discuss to conclude this whole course. And that I hope to complete it on the 30th, which is next Wednesday. So actually on the 30th I will be in my hometown, I will be in Kolkata, and I hope that the internet and everything will work there. If there's a remote possibility of something going wrong, I'll inform you. I think I should be able to do it from Kolkata. So in case anything doesn't work out, I will be able to know 1 day in advance, and then I will inform. But otherwise, I hope that we can complete our course next week on Wednesday. So today we look at the specialty Ayurveda. These are the clinical specialities. They're sometimes called as the branches of Ayurveda, the 8 branches of Ayurveda, but it's very important to realize that these are not really the branches of Ayurveda as a whole, but rather they are the clinical specialties. These are related to the clinical practice of Ayurveda. And there are 8 specialities. But today we know in modern medicine there are about more than 50, 60 clinical specialities. Modern medicine has developed into a highly specialized system of medicine. But Ayurveda is perhaps the earliest system of medicine to specialize clinically. And but Ayurveda realized at a very long time before that too much of specialization can lead to loss of the holistic and comprehensive approach to understanding human health and disease. So in Ayurveda, initially there was the 2 schools, the surgical and medical schools. So the earliest classification was the medical and science. So Ayurveda was basically divided into these 2 schools. And we have long traditions of the medical and surgical tradition in Ayurveda. So surgery was very early accepted as a clinical specialty. But later it developed into the 8 branches, and they again began to develop into sub-branches. And then Ayurveda put the brakes on specialization. Ayurveda began to point out that it's very important for the physician to know about the whole person, and that too much of specialization can actually become harmful. So came the system of learning all the 8 branches. So at one stage in the history of Ayurveda, each physician had to be learning not just one branch, but all the 8 branches together. So this was the idea of a super specialist in Ayurveda, where you don't have individual specialists in different branches, but one person who specialized in all the 8. So this is sort of an introduction, and then we look into the 8 specialities of Ayurveda. I hope you must have heard of these 8 branches. So we will quickly review them. The 8 specialities are general medicine, which deals with the overall treatment principles. This is the most important of the clinical Exactly. So Ayurveda anticipated this problem many centuries ago and said that this kind of specialization is harmful. So, but there's a logic behind why Ayurveda still allowed for 8 basic branches. So, basic specialization is necessary. It doesn't have to be that each specialty should be dealt with by different physicians. Even one physician can become specialized in all these 8 branches. So that is how Ayurveda came to be known as Ashtanga Ayurveda, or the 8-branched Ayurveda. So general medicine is most important because the principles of general medicine apply to even surgery. We cannot do surgery, for example, without having some basic understanding of the principles of general medicine. So therefore, in Ayurveda, this branch of general medicine was known as Kaya Chikitsa, and Kaya Chikitsa means the treatment of the body. And then we have pediatrics. So Ayurveda was a medical system which developed pediatrics very, very early. The tradition of Ayurvedic pediatrics at least 3,000 years. So 3,000 years ago, there was a textbook on Ayurvedic pediatrics. Imagine this fascinating, because we know pediatrics as an independent branch developed much later in the modern medical field. Psychiatry, which is another important branch, and then we have this very special branch which in Ayurveda is called as Shalakya. Shalakya means the branch of medicine which we have to use these special instruments called as the probes. So you need to go into the various cavities of the body, and you use what these probes were in Ayurveda called as shalakas. And so because this branch needs use of probes specifically, a branch called as Shalakya. It's otherwise called as Ujatru branch, which means dealing with the organs, how the neck. So it's actually dealing with ENT, ear, nose and throat, and then dentistry, then head and neck, and also oncology. So it's a cluster of all these disciplines that we understand as Shalakya. And in ancient India, actually, dentistry and ophthalmology branched out and became also very specialized in the later period of the evolutionary history. We have, of course, surgery, and there's another branch called toxicology, and we still have practitioners of toxicology. We have dentistry in India as well as ophthalmology. I mean, not the modern dentists or ophthalmologists, traditional Ayurvedic physicians who specialize in these branches. So then we have rejuvenation, which is Rasayana, which is what we, discussed in our last one and also 1 hour today. And then finally, reproductive medicine, which we will also discuss in a little bit detail in our last webinar coming up next week. So these are the 8 clinical specialties of. Now let's look at these specialties in a little bit more detail and try to understand the logic of why in Ayurveda these were the 8 basic specialties. So one of the logics behind the development of these 8 specialties is that the body needs special attention in 3 stages of its evolution and decline. So one is the adult state, and then is the childhood state, and then is the old age. So we need to treat, the treatment protocols will need to change depending on these states of the body. So the treatment protocol adult is different from that of adult. The treatment protocol for the who are aged or into their old is different from those that we would apply for children as well as for. Although the principles are same, general medicine, pediatrics, and rejuvenative medicine are based on the principles of general medicine itself, but the applications are modified according to the age of the patient or the person. So for children, the dosage is different. Some of the herbs are different. Some treatments are different. Certain treatments cannot be done in children for a certain age. Certain herbs cannot be used in children. Certain formulations cannot be used, and things like that. So the diseases that manifest in children and in adults and in old age are slightly different. So the reason why we need to look at these stages, as a specialty. So here the only thing is, it doesn't mean that you need to have, physicians or geriatricians, general physicians. Even the same physician can treat all these 3, provided, they understand these protocols and are able to apply according to the demands of this stage of the individual. Logic behind having 3 branches: general medicine for adults, pediatrics for child, and rejuvenative medicine for old age. And while the whole body can be managed by the general physician, the organs above them, they were considered to be extremely vital and critical. You needed to deal with them with more care and more. And that's the reason why ENT dentistry, head and neck, as well as ophthalmology became an independent discipline. So you needed special protocols to treat the sense organs like the eyes, nose, tongue, the throat. Dentistry again required special training to be able to manage. So for these reasons, this is an independent branch. So the body in 3 states and development, and vital organs of the that are located above the neck. So that was the logic on the basis of which 4 of the clinical specialties of Ayurveda were conceived and developed. And then look, the body can be injured from outside through 2 sources. There's always a threat that the body will get destroyed from outside. The earlier branches that we talked about, we're trying to protect the body from inside. So, diet, medicine, food, lifestyle, and all those things can help to prevent diseases and cure them in the stages of childhood, adulthood, and old age as well, these special senses and organs. But there are two threats for the human body. One is poison from outside and the other is injury. So I made a mistake here. So it should be actually toxicological medicine, and for the mistake in the slide, and surgery. So toxicology is helping to combat the effects of poison on the human body, and surgery aims to correct the effects of trauma, injury in the body. You need to do surgery when the body is injured. So instead of reproductive medicine, we should actually be reading surgery. So I'll just send the correction across. That was a typo error on my part. So I'm just trying to upload the corrected file. Just a moment. Yes, toxicology, medicine, and surgery, and then we have reproductive medicine, which is to preserve and continuity of life is achieved through reproductive medicine. So this is the logic that we have. The three states of the body, the vital organs, the two threats from outside, and then a continuity of fertility, and then finally we come to mind. There's psychiatry and psychology in Ayurveda which deals with the diseases of the mind. So after the body, the mind is taken, and so if you summarize the 8 branches of Ayurveda, 7 of them are targeting the body. One is targeting the well-being. So the branches which target the body are looking at it in 3 stages of its growth and development, and then with a special attention to the vital organs, and then protecting it from external threats like poison and trauma. And then finally we have reproductive medicine, which ensures fertility and the continuity of the human body. I hope this is clear. Okay, so we continue. Now we will try what we are going to give an overview of these 8 clinical specialties and their significance. And in the last webinar, we will go into a little bit details about what are the special contributions that Ayurveda can make through these clinical specialties. So general medicine, the branch of general medicine, which is otherwise known as Kaya Chikitsa, was known as the school of Atreya. Atreya was the founder of school of general medicine. And this school is as old as the beginnings of Ayurveda. And some of the textbooks that are associated with this branch of medicine are the Charaka Samhita and the Bhela Samhita. I hope these textbooks are known. At least the Charaka Samhita must be known. The Bhela Samhita may not be so familiar. These are two early textbooks on general. Then we have pediatrics. Pediatrics is associated with the school of Kashyapa. And some of the textbooks exclusively dealing with pediatrics in Ayurveda, the Kashyapa Samhita, and then the Arogya Kalpadruma. Unfortunately, the Kashyapa Samhita is available in fragments. The entire Yes, I can understand. These are a bit challenging to study and understand. And also the Bhela Samhita, which is, a textbook in general medicine, is available only in part. The full text is not available because they have been lost. We have only one manuscript of the Bhela Samhita, which is incomplete. And see also the Kashyapa Samhita is available only part, not the whole, but still what is available is very interesting and has a lot of information that we do not find in the other texts. Then Rasayana is dealing with aging. This is the rejuvenative medicine. We talk about it. It was known that there was specialized textbooks on this branch, but unfortunately, none of them are actually they're not available today. So we do not know if there were books that we know that, of course, we know that there are books with this branch of medicine, but they're not available today. So this I don't need to explain. We already discussed about it for the last two webinars for about 4 hours. And then we have the branch of ENT, which is ear, nose and throat. It's sometimes known as otorhinolaryngology, then dentistry, and then head neck, and then ophthalmology, and then the branch of Shakya Tantra, the tradition of which is associated with the tradition of Nimi. So there is a book called Nimi Tantra, which was dealing exclusively with this discipline, and unfortunately, this is also not available today, but there is evidence that indicates that this was a specialized discipline in the field of Ayurveda. And there is, of course, ophthalmology, which is eye diseases, and especially Tantra, eye diseases. There are even today in Kerala many traditions of Ayurvedic eye treatment. This is quite fascinating to know that if you come to Kerala, you can actually walk into an Ayurvedic eye hospital. I mean, you don't need to be an Ayurvedic physician. There are. And these eye doctors treat eye diseases, but they also treat all other diseases. So that's the importance of Ayurveda approach to specialization. Even when the physicians are specialized, they kind of lose perception of the whole approach of Ayurveda. They're still dealing with the diseases that affect the body as a whole. So we have, for example, very famous hospitals in Kerala dealing with eye diseases like Sridhariyam, there's Sunetri, and then there's Sudarshanam, and so these are all the special practice, and they're extremely successful. We also have in our hospital special Ayurvedic eye clinics, and for a lot of degenerative diseases, for myopia, for retinitis pigmentosa, for macular degeneration, and such other conditions where even allopathic medicine does not have, effective cures, Ayurveda is able to offer good solutions. So oncology is a very promising branch of clinical medicine in Ayurveda that is alive even today and is continuing to, inspire people in discovering cures for many challenging eye diseases. Toxicology is again another, very much alive today. It's called as Agada Tantra, and specialized traditions of snake poison healing are prevalent in Kerala. Our next webinar, I would like to give some examples and some experiences with the toxicological experts of Ayurveda. They are still there in Kerala. Gradually they are dying out. Healers who used to treat snake poison. And they also used to treat poisoning from other sources, from other animals, and also from artificial poisons, vegetable poisons, poisonous animals, in certain varieties of spiders, and of course snakes, because in India there are a lot of poisonous snakes. We have the cobra, we have the viper, and then we have trade snakes. So these are the most common poisonous snakes in Kerala. And there used to be a snake poisoning cases in olden days, which is reduced greatly due to industrialization and the deforestation and all that. And traditional physics well known to be able to treat these conditions very efficaciously. The story goes that when Alexander the Great came to India and he was, trying to conquer India, and when he came to India, his entire army was actually attacked and killed by many of the snakes in the country. In fact, the snakes seem to have much better fight than the Indian soldiers. And a lot of people from the army actually died because of snake bites. And then Alexander is said to have approached the Indian snake poison healers, and they were able to cure a lot of his soldiers. And so Alexander was so impressed that he took many of them back to Greece. So this is a historical account of the first-hand experience and encounters with the healing abilities of the snake poison healers. I have myself worked with some of these snake poison healers, and they have some special medicines with them And some of these medicines are also used for diagnostic purposes. Like for example, if a person comes with a snake bite, it's very difficult to know if the person has actually been bitten by a snake. Most of the time people are not able to see what bit them, or even if they are not able to identify what type of snake it is. And we also know that quite a lot of these snakes are actually not poisonous. And even when the snake bites, all of the time the venom is not injected. So it's quite a challenge to diagnose a snake poison, a snake bite case, and so these physicians discovered some interesting medicines with the help of which they would do a diagnosis. So I have tried this myself, make a special medicated jam, and this is called as a lechem. I think we studied about this in the pharmaceutical processes. And the special lechem is actually extremely bitter to taste. So if we are supposed to take a betel leaf and rub this lechem onto the betel leaf and then chew the betel leaf. And the betel leaf, actually, when you chew this, it is extremely bitter. I mean, a normal person would not be able to chew and swallow it. So it's so bitter. But when you administer it to a victim of a snake bite, then they feel different tastes. Of course, if the patient is unconscious, we cannot try this medicine. So there, they actually first revive the consciousness of the person by applying medicines in the eyes and in the nose. The mucosa of the eye and the nose helps the medicine to be quickly absorbed into the body, and then the patient's consciousness. I was trying to type. The problem is that it's not getting uploaded. Yes, I was trying to type, so I just gave up because today there's some delay for what is typed to show up. But it's okay, I can repeat any words that you couldn't follow. As I was telling, that toxicology was extremely developed, and I have witnessed many interesting cases, including the treatment of fresh snake bites. And patients, the snake bite victims, have actually been seen to recover within a few hours, and they are able to go home, but they have to be on strict diet and follow medications. There are also a few instances where they die because they come very late after the snake bite. But what I was saying is that these medicines were administered in the eyes and in the nose. They blow into the nose, and very quickly the patient regains consciousness. And once the patient regains consciousness, then the special lechem. That's what I was trying to type. It's called as a Vishahari. Yes, exactly. It's called as Vishahari lechem, or the anti-poison linctus or medicated jam. And this, as I was mentioning, is extremely bitter. But when it is administered to snake bite victims, they feel different tastes. Like for example, if the cobra has bitten, they are supposed to get a pungent taste. If it's the viper snake, then they get a sour taste. And if it's a common crate, then they get, sweet taste. So based on the taste perceived by the patient, the physician then decides what type of specific treatment is to be given. Now there could be some basis for this taste perception, because we know that snake venom is a type of protein, and when the venom spreads in the blood, it can also come into the oral cavity of the patient, and the ingredients of the medicine can interact with the snake venom and produce specific taste sensations. So this is really a very complex chemistry that is in play, and it's quite amazing to even think about how they were able to understand how to mix these herbs in such complex ways and anticipate how they would interact with different types of snake venom proteins, and then also produce very specific taste sensations. So this is the branch of toxicology in Ayurveda. And in our next webinar, we will look into a little bit more of interesting details about how this is done. Snake poison bite healing doesn't seem to be a very promising area for the future, but definitely, Ayurveda has methods to improve the toxicity, or rather neutralize the toxicity of soil. Ayurveda can prevent toxicity of even air. There are many formulations described in the Ayurvedic text where we can improve the quality of air, the quality of water, the quality of soil, and also how Ayurveda can help to treat a lot of the poisons that come to us today from fertilizers, from foods, and from vegetables, and many other environmental sources. So this is a new application for the branch of toxicology in Ayurveda, and some interesting studies are actually happening nowadays, and we will try to review some of these in our next webinar. Then comes the tradition of surgery. This is for trauma. As I was mentioning, the tradition of Dhanvantari and the Sushruta Samhita is the most monumental textbook of surgery in Ayurveda. It's the most oldest textbook on Ayurveda. And one of the kings in India was also known to be a great surgeon, and his name is King Bhoja. And he is said to have also composed some texts on surgery. This is not available today. And then there was, during the Buddhist period, a very famous surgeon in Ayurveda called Jivaka. And Jivaka was a surgeon who seemed to have also performed on Buddha surgery. And Jivaka was also a surgeon who opened the skull. He was known for his ability to do craniotomy and work on the skull, perhaps on the brain, surgeries on the brain. So Ayurveda has a very impressive history of surgery, and at some point in its evolutionary history, the branch of surgery began to decline. So some of the great achievements in Ayurveda was that Ayurveda discovered plastic surgery. Plastic surgery emerged in modern medicine. It was also inspired by Sushruta. So even today, in the Wellcome History for Institute for History of Medicine, there is the name of Sushruta on the walls of the Wellcome Library. Sushruta as an innovator and contributor to surgery, and especially plastic surgery was discovered in Europe through this technique of rhinoplasty or reconstruction of the nose. Severing the noses of people was actually a common practice in ancient days as a punishment. And Sushruta developed a method to actually reconstruct the severed nose by using skin from the cheek or from the forehead. And this practice was there in India even up to the modern times, when two Britishers actually noticed and documented this process, and thereafter, this was introduced into Europe, and then the branch of plastic surgery evolved. Ayurvedic surgeons used to do surgery routinely for urinary calculi. They used to perform intestinal surgeries, cranial surgeries, and anorectal surgeries for hemorrhoids and fistula. This is one area where Ayurvedic surgeons are even, successful today. A lot of Ayurvedic surgeons perform, anorectal surgery, and the treatments are much more effective than what is offered by modern, anorectal surgeons. So this is some of the legacy of surgery in Ayurveda. And one of the areas of offshoots of the branch of surgery is the tradition of bone setting. So just like in modern medicine, we have surgeons and we also have orthopedicians. Bone setting became a specialized discipline in olden days. And although in the classical Ayurvedic textbooks we do not find direct mention of bone setters or orthopedicians, even today, not only in Kerala but many other parts of India, there are specialists who manage fractures and problems of the bone. And this particular tradition also got very much associated with the tradition of martial arts, the Kalari system. Okay, I'm sorry. That's something which I typed long back. So it just started showing up now. So maybe I will try typing Vishahari Lekhin. Yes, so I was trying to type this out some time back. So there's some delay today for the typed words to be displayed on the screen. So the martial arts tradition was also very specialized in bone setting, and then treatment of injuries, and also the marmas or the vital points. So this is about bone setting, orthopedicians emerging as a specialized branch. So orthopedics and bone setting as a specialized branch of surgery. We have a few more slides for today. Then there is reproductive medicine. So we are almost done for today. Just a few more slides, a few more minutes. So reproductive medicine is another branch. This is called as Vajikarana. And this branch deals with two aspects. So one aspect of this clinical specialty is to actually focus on increasing the fertility. So, this deals with treatment, formulations and protocols for increasing in fertility. And then there's also Vajikarana, which was actually focusing on libido and the sexual performance, impensi and things like that. So these two things were very clearly distinguished. And so we will deal with reproductive medicine in a little bit more detail in the next webinar, and look at the practical applications, because infertility is becoming a growing concern in many countries. I was told also in Europe that it is becoming a real challenge. So after reproductive medicine, we have, the Ashtavaidyas. The Ashtavaidyas are experts in all 8 branches of Ayurveda. So this is what I was mentioning earlier, that in Ayurveda it was not considered a good practice to specialize too much in one branch. So we had in Kerala especially the tradition of Ashtavaidyas. The Ashtavaidyas were special physicians who became experts in all 8 branches of Ayurveda. And so this is the introduction to the clinical specialties of Ayurveda, and we can end today's webinar with this special message that Ayurveda looks at the need, acknowledges the need for some kind of specialization in clinical medicine, but it warns that we should not become too specialized and that we must preserve the holistic view. So to be specialized and still, holistic at the same time, that is the message of this 8-branched Ayurveda. The concept of 8 branches in Ayurveda is the concept of specializing without losing holism. And I think this is a very important message for medicine today, because in today's world, medicine is becoming too much specialized. So with this introduction, we will conclude today's webinar. I had to attend to a few tasks for my university because we're having an inspection, and so I need to sign off now. But we have only probably one more webinar to complete where we can finish this topic, 3 hours on the 8 specialities, and look at its practical application and some examples. And so I hope we can meet on the 30th at 6 p.m. Indian Standard Time.